Welcome to our discussion of 2021 in review for GRAAHI. Our theme today is It Takes a Village, GRAAHI Evolution, Growth, and Community. We want to make sure that we have a major shout out to our sponsors, Grand Rapids Community Foundation, the W.K. Kellogg Foundation, Spectrum Health, Mercy Health, Metro Health, Michigan Health Endowment Fund, Meyer Corporation, Gentech, Blue Cross Blue Shield, Mercantile Bank, Old National Bank, Herman Miller Corporation, Tiva, and there are so many more. Our purpose for today is for you to meet the GRAAHI staff, review major initiatives and impact, and introduce our goals for 2022. Just to have a quick overview of what has the history of GRAAHI, it was founded in 2002 at the Urban League by Dr. Walter Brain. Our highlight upcoming 20th anniversary and gala is one of the things that we're looking forward to. Our mission of GRAAHI is our care model to eliminate health disparities, and we have 4 pillars: community, advocacy, research, and education. We would like to highlight high-level strengths, challenges, and opportunities facing GRAAHI and the Black community. So some of the disparities and solutions that we have is for the COVID, funding, reviewing distrust, lack of representation, our vision of change. We're going to talk through infrastructure and mission and foundation. So let's go to meeting our staff. We have Ms. Ashley Jones. Would you like to introduce yourself?
Greetings, the lead community health navigator here with GRAAHI, and it's a pleasure to serve our community.
Ms. Deshaila Hodges.
Greetings, everyone. I'm Deshaila Hodge. I'm an intern here at GRAAHI, and I'm here with Taylor Bays, and I'm also a community health navigator here at GRAAHI.
Mr. Andre Ivey.
Good morning, everybody. Name is Andre Ivey. I'm GRAAHI's Director of Research, so I'm happy to be here. Yes.
Dr. Bernice Patterson.
Good morning, everyone. I'm Dr. Bernice Patterson, and I serve as a mental health liaison for the community.
So we're going to go through some of the things that we would like to share from each of our projects at this point. We're going to start with Ms. Ashley, who's going to answer a few questions of what her primary role is, what drives her passion and interest in this work, what she's most excited about, and just share what the goals and anticipate outcomes for 2022.
Good morning, everyone. Again, my name is Ashley Jones, and I serve as the lead community health navigator here for GRAAHI. And serving here at GRAAHI has been definitely a privilege. It gives me an opportunity to connect with the community that I serve, especially being a transplant here to the city. Now coming on 10 years, I've had an opportunity to really see exactly what the needs are. My passions around serving those that just don't have an opportunity sometimes to speak for themselves, but then also to undergird them and support them in different ways. And GRAAHI does align with that, and it allows that opportunity. So we are very, very excited about 2022. We are working definitely really intentionally to ensure that all members of our community have access to our COVID vaccinations and information and resources specifically. As a community health navigator, as we know that we are currently in the middle of a pandemic. And as a result of that, there are so many that have questions, they have concerns, they have fears. But then there's also been some triumphs. There's also been stories of success. And we now have the privilege of being able to support the campaigning around vaccination for our 5 and older, which I think is so incredible. We are definitely working toward an initiative of making sure that we are eliminating any barriers toward having access to that while working with the Kent County Health Department and healthcare systems and collaborating with schools. I'm very, very excited about the opportunity myself and Ms. Taylor Bays to work closely with the schools. And specifically, we're going to be working toward developing clinics and opportunities for those that are homebound to go ahead and have access to COVID vaccinations. We are looking to partner with Samaritas, which that conversation is definitely in the works, by way of Ms. Paula Collier, who has been a tremendous access and an ally, in helping us to do that. We are in the developmental phases of getting that particular clinic established and developed and moving forward with trying to get those pieces aligned. And Ms. Taylor Bays has also had the privilege of talking with Dr. Misra, who is a part of Michigan State University, I do believe, where she is looking to help us mobilize in that same space. And I'll definitely give Taylor an opportunity to kind of speak to that a little more intelligently, because she has been on the ground working with that. She is a tremendous asset to our organization and to our community as well. But then also, too, in addition to the vaccination efforts and increasing that, our African American population, we do need to know that this is something that is life-saving. We do need to know that, albeit fearful at times, sometimes when you have access to information and you have access to the education, it helps to answer those questions and give you that extra bit of courage to still go forth and do the hard thing, right? So that you can, help to sustain your life and the lives of others. And we're all working toward this together. I'm truly, truly passionate about this work because I believe that not only as a woman of color who is, a woman of color who is a professional, I'm also a mom. I'm a sister, I'm a daughter, I'm a friend, right? And it's so important that we are able to see ourselves in the community in a light space, right? Full of joy, full of excitement, full of life. And I believe that coming alongside organizations that are interested in those same factors, I think it's so important that we are able to band together and align ourselves. And that's what GRAAHI is, that passion to be on the ground level and to work with those and speak for those that can't, right? Our pillars are community, advocacy, research, and education. And all of those things, they work together hand in hand to ensure that 2022 and beyond for the city of Grand Rapids and our surrounding areas are productive and impactful. And I'm very, very excited about some of the additional work that we're doing around our, our mental health and wellness components. We are working very closely with schools and other organizations in the area that can target the needs of our future change agents, our ages 8 to 13. We're very, very excited about launching our mental health and wellness campaign. And we're also very excited about launching our wellness adventure, which will be geared specifically to our youth, in the area between those ages of 8 to 13. Most of our babies can sometimes fall through the cracks in those spaces, and we're looking to position ourselves to undergird them and to help them to tap into their genius, but also help them to develop, mind, body, and soul. You have to have healthy mind, healthy life, healthy bodies. And if we can create lifestyle changes early on, then this becomes a way of life, and we don't have to be so concerned about undoing damage in the latter years. But as we all know, COVID, it is with us. It looks like it may be for a little bit, but how we navigate this role is critical. So, in terms of making sure that we're arming our community, getting an idea of exactly what their needs are, it is extremely helpful, by way of, surveys. We're able to get a pulse of the community, hear their voice, their concerns, hesitancy, things like that. We've been able to launch launch a campaign around just kind of getting a pulse of our community. What are their concerns? What are their needs? What can we do to help to, eliminate any false information, or, eliminate the need for there to be any fear mongering, right? This is a good time to still be in the know and to be active and to be present. And that is definitely something that GRAAHI is looking to do as a community support and a community ally. And some of those things, as I previously talked about, Ms. Taylor Bays, she does a phenomenal job. She's a tremendous asset to this team. I'd love for her to chat just a little bit about some of those advancements that we're making around mobilizing with community to ensure that the vaccination is accessible and available, so that those that want access to it, they won't self-select out because of concern of transportation or concern of it being, available to them near home, or even just someone to help walk through the process with them with a face that looks like theirs. So Taylor, if you could talk a little bit about that, that'd be awesome.
Yeah, so right now we are working with the Kent Health Department, and we have training actually tomorrow to talk about transportation, how to help the African American community who don't have cars get transportation to the clinics and so forth. And we specifically, the Grand Rapids African American Health Institute, we're looking to start our own clinic, as Ashley stated, with hopefully partnering with Samaritas. And then hopefully with Dr. Misra's help, we will partner with the Michigan State University residents, medical students that are residents now, and getting them to volunteer and give out these vaccines at this clinic.
Thank you. Ms. Shayla, do you mind talking about your role, what drives your passion, what you're excited about, and what's your goals for 2022?
Absolutely. I've been here at GRAAHI for a couple months now. I started in August. I'm a master's of public health student at GVSU. And so being an intern and coming into this role under the care of Ashley and Taylor as a community health navigator intern, it has been a joy. Propelling our passion into the community, building community partnerships. And we've been working on a youth mental health initiative. As Ashley mentioned, the Wellness Adventure Program is a program that has been grant funded by the Michigan Health Endowment Fund. And we have support from the Meyer Corporation, Herman Miller, Blue Cross Blue Shield, and Spectrum Health to help the Black youth population, specifically ages 8 to 13. We're looking to address mental health issues in the Black community, especially among the youth population. Studies show that suicide attempts among Black youth have increased by 73% from 1991 to 2017, while suicide attempts among white youth decreased. Furthermore, 25% of Blacks seek mental health care compared to 40% of whites. So we really want this program to, like Ashley said, create a lifestyle change and provide a safe space for Black youth that is not always provided. Provide them with life-changing skills, personal development skills, nutritional skills, and exercise skills. And those are the components of the program: nutrition, exercise, and personal development. And so we're looking to have at least 50 to 75 participants throughout the program. And we really want to create change for future generations to come. We're hoping that the participants throughout this program will take what they have learned and propel it into their adulthood, use it throughout their life, tell it to their friends and their families. So we do want it to be a family initiative as well, where the participants can include their family members. And we're really focusing on the nutrition and exercise, because we believe that taking hold of your nutrition and your exercise can help your personal development and ultimately your mental health. And so I want to give Taylor a chance to speak to the exercise component that she has been working so diligently on. Yes, so for the nutrition and exercise component, for the nutrition component, we're partnering with Curbo, which is a portion of Weight Watchers. So Curbo is a mobile-based coaching program that teaches healthy eating habits. Kids and teens
ages from 8 to 17 get to pick what they eat using the traffic light system, which is a green, yellow, red approach to food adapted from Stanford University, and it's backed by 30 years of research, which guides them towards balanced, healthier food choices. And with this nutrition app, the kids will also be paired with Curbo coaches who are trained experts in health and behavior change, and they will meet with the kids and teens weekly, one-on-one via Zoom. And then for the exercise component of the Wellness Adventure program, we are partnering with Amber Mayfield from Soulful Motion, and she is helping us create videos, dance videos, exercise videos for these kids to just really get them interested in exercise and having a fun way to exercise and move their bodies with kids their age as well. And then for the mental health component, we are partnering with the Family Outreach Center, and the kids will have bi-weekly meetings with different therapists and mental health leaders to just discuss anything they feel is necessary, anything going on in school, anything going on in home, things that they're doing with us, with Curbo or with Soulful Motion. And so the kids really feel like they're important. They really feel like they matter, and that will help their mental health as they continue to grow up.
And furthermore, to also involve the community on this mental health initiative, we will be releasing videos and graphics speaking to raising awareness surrounding mental health and self-care and wellness. So thank you.
Ms. Ashley, can you have your last points that you wanted to address?
So as you see, we have a phenomenal team. Both Deshaila and Taylor are definitely dedicated to the work that we do. And they are definitely helping us to build relationship with community members. And in turn, it does build trust equity. And once you've built that platform of trust equity and support, you also create a safe space where others in community can be vulnerable with you, and you can have the difficult conversations that's necessary. But then also too, there's a trust when you say, hey, I'm concerned about your well-being and I want you to be here with me, and these are the reasons why we think that these lifestyle changes are necessary, and this is why COVID, vaccination and immunization, things of that nature are important to us. So, we have some very aggressive goals for this year, especially with COVID being at the forefront of everything. These types of programs, they help us to really move the needle. And what we are anticipating and working diligently toward will be for the first quarter of 2022. We have a very aggressive goal through these programs, through the mobile units, through these clinics, to increase vaccination, to increase awareness by at least 3%. And some would say, oh, 3%, that's not that much. But that's a huge dent considering, and if we can keep with that momentum, hopefully we'll be able to have push the needle forward beyond what we've even anticipated, where at one point or another, we'll be able to not just host these types of events virtually, but then we'll be able to host them in person again. Because I don't know about others, but I'm highly relational. I love people. I prefer to be in the space with people because it increases your energy. It's something beautiful about tapping into the genius of others when you're able to hold them close. So we definitely have some aggressive goals. We're going to push that needle. We're going to get that 3% increase, and that 3% will turn into 6%, which will turn into 10%. And then we'll just kind of keep going from there. So we thank you for this opportunity just to kind of forecast some of the work that we're doing and where we're looking to go, and just allowing us to really position ourselves to serve and undergird this community that we love so much.
Thank you, Ms. Ashley. Our next person that we're going to have speak is Mr. Andre Ivey. So can you just go through the questions of your primary role, what you're passionate about, and what you're interested in, what's your goals for 2022?
Sure. Again, my name is Andre Ivey. I am GRAAHI's Director of Research. I have many roles with GRAAHI. So one of my main roles is really around managing GRAAHI's Health Equity Index. This index was developed in 2014, and this index is very robust, it's very comprehensive. It was developed really to be able to have a resource base of data and disparities for African Americans and other groups across West Michigan. It includes health equity or health indicator data for around 15 indicators at the county, state, and national levels. It also has disparity data for around 28 indicators for race and ethnicity. It has interactive data maps that look at so-called the rates of and conditions of things, at a census tract level across Grand Rapids. It includes over 450 health recommendations. It also has over 400 online resources. So this has been a tool of GRAAHI that has really driven our efforts for the last several years. Keep it updated manually myself with data updates and information along, over the year. So again, that's one of my main roles with GRAAHI. I also look at, developing high-level approaches of using evidence-based and practice-based strategies, making sure that I use translation approaches and dissemination approaches that are very evidence-based and very practice-based. So those are sort of the overarching roles that I have with GRAAHI. What drives my passion is really around the idea and the fact that as a Black professional, there's a scarcity of resources that are out there for Black people. We know that Blacks experience the most and the worst health disparities across the country for many different indicators. And the same exists in Grand Rapids and King County. And so I'm very passionate about creating these resources and tools that can then inform change, inform information, inform health literacy. So that's really overall my passion there. I've been in public health for over 15, 16 years now. And so I've witnessed many different transitions of thought and information from, programs, the policies, the systems approaches. And so I'm just very much keen on being able to push the needle on resources and research as it pertains to Black people. Currently, I'm very excited about the remodeling of GRAAHI's Health Equity Index. So currently, I'm in the process of remodeling this index with a website contractor that I'm very familiar with. So we're currently going through the index. We're redesigning it, we're reformatting it. We are creating another color scheme to it. We're making sure that this index is going to probably be even more user-friendly than the other one. We're going to be sure that people can more quickly access resources and recommendations in Grand Rapids, because we really want to be able to track how well the index does for connecting people to the resources to really impact change over the years. So again, I'm just always trying to be innovative and creative with the resources that I develop. Got a question, somebody?
Yes, Mr. Andre, can you share your recent contact regarding your health equity?
My recent
contact related to your health equity. That's an accomplishment of yours.
So a recent, you mean accomplishment, you mean?
Yes.
Yeah, so actually recently this past year, I finished the completion of a health equity report. This was a very rigorous process that I engaged over the last probably year. It's a 40-page report. It includes lots of research, a lot of resources, a lot of data, where I kind of showcase health equity disparities and also health issues for Blacks, whites, Hispanics across Grand Rapids. I also look at how well Grand Rapids does for this city and also for the state of Michigan. I also cover COVID-19 data as that relates to race and ethnicity as well. So that's currently being shown on our website. If you go to our website, click on the research tab, you'll see that report there. That's one of the main things I've done recently this year. Again, it also has lots of recommendations. I look at a socio-ecological model where I break down recommendations for like the person, the community, looking at policy, looking at organizational recommendations. Another thing I did this year, so early this year, I was invited to join Governor Whitmer's committee. So I think many people are familiar with, last year, Governor Whitmer appointed 16 people to her Black Leadership Advisory Committee to really address health inequities in Michigan. That was a really big thing going on last year. So they have this 16-person committee that they created last year. So they actually had the power to then create subcommittees. And I was actually asked to join their health subcommittee. So over the last 7 to 8 months, I've been working with this health subcommittee, giving them ideas and recommendations to give to Governor Whitmer. So we're currently in the process of developing these recommendations. We have a town hall meeting that's going to occur next month. Our current focus is mental health, which also matches GRAAHI's focus. So I'm very excited about the mental health focus, which gets into another thing I did this year. I developed a mental health research brief for GRAAHI that kind of covers the mental health and mental illnesses that are, the basis of those, the disparities of those in King County, Grand Rapids. And so that document is also being used to inform the committee to then inform Governor Whitmer. Another thing that occurred recently is we were contacted from some researchers at the University of Oklahoma. They're very much interested and intrigued to use the logic models that were in the Health Equity Index. They were very impressed with them, and so we're actually in the process of developing write-ups that will be spotlighted in one of their textbooks in the very near future. So it's a very, very good thing that occurred with the logic models with the index. And my goals and expectations for 2022. So again, I think I'm very much excited about finishing the remodeling of GRAAHI's Health Equity Index. I believe that when that is done, that will be a great accomplishment. We will then go out, do a lot of outreach efforts in the community to really get more people aware again to the index, looking at how we can promote it across organizations, across systems, and then looking at how we can track how well the index is successful at connecting people with resources and recommendations, and how that informs their behavior. So we really want to get at the impact that these resources are having in the community. So yes, those are sort of the main overarching outcomes for 2022. Yeah, if you have any more questions, just please let me know.
Thank you. Dr. Bernice Patterson, if you can share with us what your role is, what you're passionate about, and what your interest in this work is, and what are you hoping for the future in 2022?
Definitely. First of all, thank you all very much for having me on this morning. So as she said, my name is Dr. Bernice Patterson, and I am the founder and CEO of Infinity Consultation Group. I have had the pleasure of being asked to come on as a consultant for GRAAHI. I started out as a member of the advisory council, which is made up of professionals throughout the greater Grand Rapids area and surrounding communities, to really help the illustrious CEO, Vanessa Green, who is absolutely amazing at what she does, to really help her get a deeper connection in different areas where that is our subject of study. That is the place where we shine. So as a mental health professional, and also a licensed and ordained member of the clergy, I have been put in this really awesome position to not only speak to the world of mental health, but also helping GRAAHI look at how can we make that connection with our church communities. As many of us know, the church tends to be the cornerstone of the Black community. So really being able to help not just individuals in the community, but also other organizations such as different church and faith organizations understand how they play a role in the mental health of the community and of the individuals in the community has been this really amazing role that I've been able to stand in. So going forward, one of the big things that I really get to help do is help figure out where are some of our mental health gaps and how do we fill those things. As a Black psychologist, I can honestly tell you I'm considered what we call a part of the 1%, where there's only 1% of those who hold a PhD in psychology identify as African American. Now you think about that. If you are looking for a Black doctor, you are now looking, who's a psychologist, you're looking for a needle in a haystack. So being able to create this space where we can not only educate people about mental health, but also help them get connected to practitioners and providers who look like them and come from their community makes such a big difference. So I have the privilege to also be connected to a wonderful organization based out of Grand Rapids called the Mental Health Clinicians of Color, who will be able to help provide providers lists, referral opportunities for us to actually get people connected to psychologists and counselors and social workers in their community who look like them and who identify as BIPOC. When we talk about being passionate about this work, I have worked in the field of psychology for the past 15, going on 16 years. And I see it as less as a passion and more of a calling. I truly believe that the work to sit with people while they are hurting is something that you are either called to do or you will get consumed by it when trying to do it. And I count it a blessing and a privilege to feel called in order to do that work, to sit with people while they hurt and remind them that there is yet hope. And I think with an organization such as GRAAHI, we have the ability to sit with a community and tell them, though we are hurting, it feels like we have been in this never-ending storm, be it the medical pandemic or the cultural pandemic around racism, that there is yet hope, and that GRAAHI can stand to be an anchor in the midst of the storm to help people really get connected to the needs that they have and to get to the services that they actually need. From a more of a spiritual standpoint, being a licensed and ordained minister, I oftentimes sit with clergy members, sit with parishioners, and find that people are hurting and struggling with mental health issues, but find that it is an inundation of their faith for them to say that I need to seek out psychological help. And I'm a big proponent of teaching people that you can have Jesus and a therapist too. They are not mutually exclusive. Jesus is not offended nor threatened by your Blue Cross Blue Shield benefits, but to be able to help people really connect the idea of their faith can help bolster mental health care, and mental health care can help bolster their faith, is something that I think is a radical way of looking at healing, but also seeing it as a way to let people know that they are human at the end of the day, that needing mental health care is not that you are weak. It is not that you have somehow failed. It is the result of the human condition. Mental health is not a poor problem. It is not a rich problem. It is not a white, a black, or brown problem. It is a people problem. So being able to step in and really help guide this conversation around how do we get people connected, for me is a huge passion. As for what my hopes are for 2022, one of the big things we are really excited about is really increasing access, and helping people not only know where to go, but teaching people how to actually seek out therapeutic help, how to have those conversations at home. Even with the programming that we have focused on our 8 to 13-year-olds, changing the narrative of talking about mental health needs to be as natural and normal as talking about your physical health, because in reality, your mental health is a part of your physical health. Oftentimes in African American communities, we have the highest rates of diabetes and high blood pressure and heart disease. This is not because our diet is drastically different than white America. The reality is we deal with a different level of stress that causes us to have more medical problems. Those things can be addressed in therapy. So teaching this next generation that going to a therapist is just as natural as going to get your physical to play sports, is a way to start a generational relief and a generational release of healing into the masses, but not forgetting those who have already come through that age group, and say like, hey, how do I take care of you as you are in like the senior part of your life or the adult part of your life? Because reality we are all hurting and we all have things that we need support around. So being able to increase awareness, increase access, being able to tear down barriers, and also just tear down a lot of the stigma around mental health. I think it is a beautiful thing that we are talking about self-care more. We are talking about being more connected, being more holistic. But the reality is we oftentimes grow up in a what happens in this home stays in this home mentality. So I believe really pushing out this message of mental health is just your health is a way that we can begin to push back against those things and really allow people to know that there's help and there's healing and support available in the community.
Thank you.
Mhm.
Lastly, I'm going to introduce myself. My name is Mykesha Plasko. I'm the Director of Operations at GRAAHI. And I support not only our organization, but our community in COVID-19 and our Pathways, WK Kellogg's Pathways program. What drives me in this work really is a personal endeavor, because I was in a program similar to the Pathways program, where I was able to be introduced to a healthcare career, and was able to go to a health professions class in college while I was in high school. So that was really exciting for me. I was able to do this program. They gave me an overview of all these different health professions, and then they were able to also provide me with medical terminology, which is helpful to get into healthcare. And then I was able to go into a CNA program while I was in high school and be certified in that area. But then 22 years later, I became a licensed nursing home administrator. So I was able to afford this benefit of being in a space and being able to be supported through a program that was similar to Pathways. And that's what I would like to provide to other students of color, to be able to be introduced, to be supported, to have mentorship, to have barriers removed in this area. So I'm very excited about working in with the healthcare systems, colleges and universities to make real structural changes to increase people of color in careers. Another thing that I've worked with was the COVID-19 initiative. We had a panelist discussion, and we partnered with Grand Rapids Public Schools. We also partnered with all 3 of our hospitals, so University of Michigan West. We had Mercy Health, Spectrum Health. We had Cherry Street Health, Kent County Centers for Adolescents, and Child Neurology, Alger Solutions. We also have Mission Point, and we worked together to have this panelist to have a real conversation with parents so they are able to ask the questions about COVID-19 and vaccinations about their children and be able to make an informed decision. What we end up having, and I wanted to share a couple of quotes that we had from parents when they did our survey at the end of these discussions. One parent said, "I do feel much more confident in having my child vaccinated. I wish I could convince my family members who refuse to get vaccinated. Thank you for this discussion." So that was one parent. We had another parent who said, "I appreciate the feedback and leaning towards vaccination." And our third comment was, "Having young children almost to vaccination availability, I'm planning to check on the website that you provided by the panel to further research and understand. I'm vaccinated and I want to do what is best for my children." So this is the impact that we had in our community. And it was very exciting to be able to share with these parents and then have that reaction about it. So our goals and what I anticipate for 2022 is for our Pathways program to have our pilot program, but also have our steering committee to actually have these conversations around what this could look like in the future for their organizations, for the universities and colleges, looking at the admissions process and what can we do to remove barriers for students of color. We're also looking at to increase COVID-19 vaccinations, as Ms. Ashley had discussed, among people of color through education and accessibility. So those are the primary things that I'm working on. I'm very excited about being at GRAAHI. And we have Ms. Vanessa, who will close us out here.
Well, good morning, everyone. I am Vanessa Green, the CEO of the Grand Rapids African American Health Institute, and I'm delighted to be here and amongst my colleagues, my friends, my staff, all of whom are incredibly dedicated and committed to the work of helping to dismantle some of the disparities around healthcare and health equity in our community. And as you know, or many of you know, that as we think about our theme, Village GRAAHI, evolution, growth, and community, this has been a year of evolution, growth, in community. And because I started GRAAHI in November of 2019, at a time when COVID was really at its worst. Everything was shut down. Over 600,000 people had lost their lives. And so starting an organization in the midst of a pandemic of this nature that was impacting the world at large, and specifically the African American community was hit harder than other communities. So we all had to come in during the midst of this pandemic with our rollerblades on, our roller skates on, and we've not taken them off yet because there's so much work to do in order to have the impact that we need to have within our community. And this is impact that we cannot do alone. And we're grateful for the community collaboration and support. And throughout this year, we have collaborated with the community at large, with the Kent County Health Department, with all of the healthcare systems, Spectrum, Metro, Mercy, Cherry Health, with other organizations like Urban Link, the NAACP, Baxter Community Center, and the list can go on and on, the Black clergy, the Black Greek organizations within our community. And in order to come together and work together to try to address the need, not just around COVID-19, but around many of the other disparities that the staff have discussed in this meeting today. And what I want to really emphasize is that COVID-19 is real. And it has impacted us not just from a physical standpoint, but from a mental and a spiritual standpoint. And the effects of it will be long term. And the work of GRAAHI then is more meaningful, is more important than ever. And we need the continuous support and collaboration of our community at large. And we are really excited about some of the things that we have in place. And the staff, they've talked about many of the programs that are taking place and that will continue to grow in 2022. A couple that I really want to highlight is the community COVID vaccination campaign that GRAAHI was selected to lead this community-wide initiative. We will have over 20 partners, and we will be in this community providing education, awareness in efforts to try to increase vaccinations. And I know that there are a lot of people out here who don't believe COVID is real, who have like anxieties in so many different levels. And we are not here to force anything upon anyone, but we are here to educate. And one of the things that I want to emphasize is that our hospitals currently are filled with patients, and many people are in ICU. And based on the data, 98% of people in ICU are unvaccinated. And so as you're thinking about the issues of COVID, how it relates to you, how it affects you, and the decisions that you want to make around that, I want to clearly emphasize the fact that 98% of people in ICU today, and these rooms are filled, are unvaccinated. And so we have a huge a mission to save lives. And that's what our mission is all about here at GRAAHI. It is to help dismantle health disparities, to advocate, to challenge systems, to create change, and to break down barriers to create greater health outcomes within the community. And essentially, it relates to saving lives and the way that we feel physically, mentally, the access that we have to health care, it matters. And that is what our primary focus is on. And I want to just really take time to introduce some of the sponsors, because this work cannot be accomplished without the many sponsors that support our work. And I want to highlight some of them, and I know that I will miss some. And so for those that I may miss, I ask for forgiveness in advance. But I do want to highlight the Grand Rapids Community Foundation. When I first started here at GRAAHI in 2019, I called out to Diane Seeger, the president of the foundation, and asked for her support in increasing staffing. And she listened, she heard, and provided funding from her organization to support the staffing growth of the organization, GRAAHI. And I want to thank the foundation for that support, and it has been instrumental in the new staff that we have on board. And I tell you, I could not be more excited about this dynamic staff. And when we think about people and who they are, everyone comes with a story. And I love stories about, people's background and where they come from, because essentially our stories inform our lives, they inform our passion, they inform our dedication and our commitment and our sense of purpose of what we're doing. And GRAAHI is research-based, scientific-based, purpose-driven. And I could not be more excited about the purpose-driven staff that we have. And you've heard from most of them, if not all of them. But we have Keisha Plesko, who is our director of operations. And as she mentioned and spoke on, she's doing phenomenal work with our Pathways program and assisting with COVID and the operational needs of the organization. Ivey has been around for a while, and he is the brilliant epidemiologist who does all the research for the organization and really informs us on what the greatest disparities are and what our focus areas need to be on. And so just a huge shout out for Andre and all the work that he has provided to GRAAHI. And then we have Miss Ashley. Ashley is just dynamic in every sense of the world, like high-spirited, and just brings energy every day with her level of passion. And she's our senior community navigator and supervising the work that is related to increasing vaccinations within our African-American community. And very new on staff, who started this week, is Stacy Baker, who is a program coordinator who will be direct support to Markeisha, and we're really excited about him. And one of the things I also want to add too is that this team is like very Christ-centered in worship, like centered, and they lead worship in many of the congregations in our community. And so it's just been really interesting to see how that part of the evolution has been happening here within the organization. And then we have Leandra Holmes, who is our office manager, and we're just so excited about her spirit and her warm spirit and sense of community. And then we have Taylor Bays, who is a recent graduate from University of Detroit and has had extensive experience in research, working alongside a researcher at her university. And she brings a breadth of knowledge in terms of health equity and research that's instrumental, and will be assisting Ashley with our community navigation outreach into the community. And we have Dashala Hodge, who is our graduate assistant. Brilliant. The team is just brilliant and passionate, and has done so much within the time period that they've been here. And we have Dr. Vicki Lynn Holmes, who is the assistant grant writer and program developer, and very excited about all the work that she's been able to help us do within our fund development outcomes this year. And last but certainly not least is Barb Lash. And Barb has also been, or has been, with GRAAHI for a number of years, serving as our public relations marketing person. She's responsible for our website and all the social media and graphics that we do, and just supporting every single aspect of the organization. And so just a huge, huge, huge shout out to the staff. And I would like to go back to the slide with the sponsors, because I want to take time and give them just my gratitude for the support that they have provided to GRAAHI. So Barb, if you can go back, thank you. So we have the W.K. Kellogg Foundation, Spectrum Health, Genentech, Meyer, Michigan Health Endowment Fund, Blue Cross Blue Shield, Herman Miller, Pfizer, Metro Health, Mercantile, Urban Core Collective, Teva, and CVC Pharmacy, in the Black Greek organizations. So just to name a few, and there are many more. And as I have said, that we cannot do this work without the generous support of these sponsors. And I also want to acknowledge our board of directors, and our board chair is Paul Doyle. And then we have Jean Nagelkirk, Carrie Madden, Laura Moody, Dr. Con Nad, Eddie Rucker, and Dr. Herman. So those are our board, Herman Sullivan. And so those are our board members. And then I want to also just give a little history, because I think that is really important as we are also evolving into 20 years of service of the Grand Rapids African American Health Institute. So we were founded in 2022 as a direct effort from the Urban League organization, and it was led by Dr. Walter Brame in 2002, and he saw a need to have a community-wide survey to address health disparities. And the outcomes of that survey, it proved more daunting than I think that anyone could have realized. And as a result of those findings, a huge committee from every sector of the community came together and identified a need to start an African American Health Institute. And so under the leadership and director of Dr. Walter Brame from Urban League in 2002, GRAAHI was founded. And I'm excited that we will be celebrating our 20th anniversary next year. And we have a lot of work ahead of us. guys. We have a lot of work ahead of us, exciting work, meaningful work, and impactful work. So we ask that you just continue to walk alongside us as we work to eliminate and end disparities, try to mitigate this COVID and end this COVID pandemic. In the inequities and disparities that we have in so many areas, including diabetes, heart disease, infant and maternal mortality. The list can go on and on. Heart disease, HIV/AIDS. We've got pressing issues in our community, and GRAAHI is prime and ready for this task, for this challenge, and we are determined that we will continue to make a difference and an impact as we continue this work. So thank you all so much for being here with us today. And we will have our 2022 annual report up for you, where you have a lot more detailed about the work and the impact that we're having in this community in ways that you can be involved in the fight against these inequities. Again, thank you so much, and thank you to the staff for being here and for all the excellence and dedication and impact that you bring to this team. Thank you.